Dr. Dyan Hes joins us now. She is the founder of Gramercy Pediatrics in New York City. So, doctor, we have to sort of keep explaining to people what the numbers and statistics mean because, as we know, people use numbers sometimes to kind of misrepresent the truth, or they can be confusing without context. So here's a number that I think people might zoom in on. They already know that, kids as young as 5 can receive the vaccine, and that has been happening. We talked to you about how busy your office has been, yet we are seeing pediatric cases on the rise in this country. So how do you explain that to someone who says, wait a minute, kids are getting vaccinated, but yet kids are also getting the coronavirus? What's going on?
Well, the kids who are getting the coronavirus are either the kids are completely unvaccinated, or maybe they just had their first vaccine and they're not fully vaccinated. You have to remember that as more and more adults are vaccinated, the vaccine is going to go to the unvaccinated. And when you're talking about pediatrics, you still have that whole population under 5 that's not even eligible for a vaccine. So we're still seeing more cases.
Doctor, as you know, some parts of the country are seeing a spike in cases ahead of Thanksgiving. So as millions of Americans get set to travel for the holidays, what are you thinking about post-Thanksgiving?
I think I'm going to be very busy.
Really?
It's not just COVID. There's so many viruses going around right now. That's what happens after you've lived in a bubble for 20 months. So, our office is so busy because so many kids have fevers right now, and the parents are afraid to travel with them. Luckily, New York City really isn't seeing the surge of COVID. There are, sporadic cases here and there in my patients, but that's usually from a breakthrough case from a parent who is already vaccinated. But I think that going on a plane, you don't know if the person next to you is vaccinated. People take off their mask to drink. People take off their mask to eat. People take off their mask because they don't listen to rules. I'm really nervous about the plane travel. That being said, I hope more and more people will have days off now and say, you know what, now I have a day off. I can take my kid to go get vaccinated at a pharmacy or at their doctor. And this is a time that, I know some people who are getting vaccinated as a family this weekend, and I think that would be a great family activity.
Yes. I wonder if I can pitch that to my kid. Family activity.
The parents get boosted and the kids get vaccinated.
Right.
Right. And then we all go out for lunch or something. Speaking of the vaccines, I think the last time we spoke to you, you were expressing some frustration that, you weren't able to book more people wanted to come in and get their kids vaccinated, but you couldn't because you were running out of vaccine and you had no idea when you were going to get more. How are things going now?
So we got 200 more vaccines yesterday. But it's not easy. And the frustrating part is if you're not persistent and you don't have the staff or the time, you just won't get more vaccine, or you won't get any, period. I have friends, we all applied for the vaccine at the same time, and I have friends who just received their first shipment, last Friday. And now we also know that nothing is going to be shipped out during Thanksgiving. But we do, the good thing is that large pharmacies do have the vaccine. So if you want the vaccine, you can absolutely get it. I think in New York City, there's been such a rush for boosters that the appointments at the pharmacies are filled. They're not filled for kids. They're actually filled for adults that are getting boosted. So the pharmacists just don't have time. But I think if you call around now, you can absolutely get your child vaccinated if you want. There are many, many centers. In New York City, we have mobile pods. They come to the schools and they're parked in front of the schools to get vaccinated. So you can get it now if you want it.
So, Dr. Hes, Dr. Fauci says that fully vaccinated does not include the booster shot. Former commissioner of the FDA, Scott Gottlieb, was on Face the Nation with Margaret Brennan on Sunday, and she asked him about potentially needing a booster shot to be fully vaccinated. I want to play a bit of what he had to say.
Should the CDC say you need a booster to be considered fully vaccinated?
I think at some point they're going to, but not this year. I think eventually this will be considered a 3-dose vaccine, but I would be hard-pressed to believe CDC is going to make that recommendation anytime soon, in part because of this debate about whether or not younger people who are at less risk should be receiving that 3rd dose.
So what did you make of Dr. Gottlieb's assessment? And as a pediatrician, do you think that booster shots are something children will eventually need?
So I think for adults, I wouldn't even say booster shot. I think it's going to be a yearly vaccine, just like the flu vaccine. I think that right now it's going to be a booster because that's the word that we're using because we just don't know. But I think that our immunity is going to wane and COVID is going to mutate, and they're going to tweak the vaccine just like we tweak the flu vaccine or other vaccines for viruses when viruses mutate. And I think we're probably getting a yearly shot. I think that the CDC has always been behind the 8 ball with this. I always take Israel as a lead because they started the vaccinations first. In Israel now, to be vaccinated, you have to have 3 vaccines. And I think every week that we talk, we change the guidance by the next time I speak with you, because we're just like catching our tails. And for children,
health
I think
officials,
it's too early to say. Sorry.
Too early to say. No, that's good. That's an important bit of information. Health officials are urging adults with psychiatric conditions to get booster shots to increase their protection. I think the CDC sort of added mental health challenges as kind of one of the amongst their list of people who are particularly vulnerable. And I think a lot of times when you think of underlying conditions, you think of physical conditions that diminish your immune system, but mental illness is also a factor and a risk factor. Can you sort of explain that?
Yes. So there's 2 reasons, or there's multiple reasons, I should say. So we know that people with mental illness, if it's serious mental illness, they often don't take good care of their health because they're too impaired. So they might rely on a caretaker, a parent, a relative to encourage them to go get, wellness checks or to take their medicine. We also know that when you are chronically ill, you develop mental illness. So if you have obesity, depression is very common. If you have diabetes, depression is common. If you have heart disease, if you have cancer. So mental illness goes hand in hand. I'm an obesity medicine specialist. The most common comorbidity in obesity is depression and anxiety. So, and these are the patients who do the worst with COVID. We know that obesity is probably the #1 risk factor for a poor outcome. And we also know that mental health is not well covered in this country. Insurances do not reimburse doctors well for mental health care, and they don't provide their patients with adequate coverage. So we have many people with mental illness who are untreated, which is the biggest problem. And they are untreated for their mental health, and therefore they're also untreated for their regular physical and medical health.
All right, Dr. Dyan Hes, always great to have you. Thank you very much.
Thank you. Bye-bye.